Ying-Spring points, PC8, Palace of Toil. Location in the center of the palm between second and third metacarpal bones, slightly closer to the third metacarpal bone. How to find: when making a loose fist, the tip of the middle finger will rest on PC8 between the second and third metacarpal bones, slightly closer to the third metacarpal bone. Part 8 is located more radially between the fourth and fifth metacarpal bones, needling vertically 0.3 to 0.5 June. Thinner needles should be used as needling this point can be painful. Action indication: clears heart fire and calms the Shen, harmonizes the middle burner, clear the Ying nutrient level, and cools the blood. Special features: Ying-Spring point, fire point, bend point by faces, Susin Miao ghost point, and exit point. PC8 is the most effective point on the pericardium channel to clear heart fire. Being the spring point, it is particularly dynamic point to clear it. In particular, it has a specific effect on clearing tongue ulcers deriving from heart fire. In acute febrile diseases, PC8 clears heat and cools blood and is used for high fever at night and delirium. It drains heart fire in heart pain, tongue ulcers, thirst, insomnia, agitation. Calms the mind, in manic behavior, pride, anxiety, mental restlessness. It also clears heat, cools blood, and promotes resuscitation. In febrile disease, at the nutritive chi or blood level, loss of consciousness, agitation, mental restlessness, delirium, cold hands, fever at night, dry mouth, coughing, or vomiting of blood macules. PC8 is the Ying-Spring and fire channel. According to the classical difficulties, Ying-Spring points are indicated for heat in the body. PC8 is a powerful point to revive consciousness and calms the spirit in cases where heat collapses into the pericardium during the course of febrile diseases, leading to disturbance of the emotion and, in severe cases, coma. There are two major discussions on the relationship of the heart and the pericardium channel in the spiritual pivot. At this early date, it is clear that the pericardium channel was considered to be the main channel that linked with and treated the heart itself, and indeed it was said that the heart channel had no shoe points of its own. PC8 being listed as the Ying-Spring and fire point of the heart channel, it is therefore not only used to clear febrile heat from the pericardium and the wrapping of the heart, but is one of the principal points to clear heart fire generated by the internal disharmony. Heart fire may result from a number of different factors, but due to the close relationship of the pericardium and the liver joining channels, PC8 is particularly indicated when stagnant liver fire transmits to the heart. If heart fire agitates the spirit, there will be various manifestations of psycho-emotional disharmony such as mania, depression, propensity to anger, ceaseless laughing, and epilepsy. Like PC7, PC8 is also able to bolster the spirit and is indicated for such manifestation of the deficiency as pride, sadness, and apprehension. If heart fire condenses body fluid, may generate phlegm, and when this is combined with wind stirred up by liver yang, the resultant wind phlegm may give rise to epilepsy or wind stroke. The importance of PC8 in the treatment of epilepsy and also mania depression is reflected in its inclusion under its alternative name of Ghost Cave by Sun Simiao in his 13 close points for the treatment of these conditions. The heart flowers into the tongue and the spleen opens into the mouth. Mouth and tongue ulcers are differentiated into 6 main patterns: heart fire, spleen and stomach smoldering heat, kidney and heart yin deficiency. Spleen qi deficiency complicated with heat, blood deficiency with dry heat, and kidney yang deficiency. PC8 is indicated for ulceration or erosion of the mouth and tongue from any of these patterns, especially when heat is involved. The pericardium primary and divergent channel pass through the diaphragm to the middle and lower jaw, and the pericardium channel is exteriorly coupled with the sunjaw channel. Like many points of the pericardium channel, therefore, PC8 also has a strong action on the middle jaw and is indicated in cases where fire disrupts the descent of stomach qi, resulting in foul breath, vomiting, and difficult ingestion. In common with PC3, PC7, and Shong Chow PC9, PC8 clears heat from the nutritive and blood levels. May therefore be used when febrile heat of the blood level leads to reckless bleeding disorders such as vomiting blood, nosebleed, blood in the stool, etc. Its ability to clear heat from the blood as well as its location make it suitable for skin disorders affecting the palm, such as eczema, tinea, and scaling, as well as for heat and abnormal sweating of the palms. It is also indicated for palm painful obstruction and hand tremors. In Qigong practice, PC8 can be thought of as a mirroring kidney one on the soles of the feet. It is common practice to breathe through either of these points, and focusing on and building the qi at PC8 is a prerequisite for emitting qi in the treatment of disease by Qigong therapy. Finally, PC8 is cited in the Song of the Nine Needles for returning the yang for the treatment of collapse of yang characterized by loss of consciousness, aversion to cold, counterflow of the limbs, purple lips, etc.